Good afternoon, everybody. My name is Sinead Lucy from the Royal College of Physicians here in Ireland, and you're very welcome here today to our webinar on the International Clinical Fellowship Programme. So over the next hour, you will hear from a number of both staff at RCPI and our clinical doctors in the panel discussion, and we're going to cover an overview of the Royal College of Physicians of Ireland, the International Clinical Fellowship Programmes, the recruitment process, the onboarding process, what to expect after joining, and then our partners for onboarding, Castell Education, will also give an overview of their assistance and some of the onboarding process. And then at the end, there will be a 15-minute session with key panel discussion with some of our clinical leads on the programme. So we're going to go ahead. I'm going to give the first overview of just the college itself and share a video to give you a flavour of what it's like to come to Ireland and to train here on our training programmes. So the International Clinical Fellowship Programme has been in place since 2014, and we have over close to 200 graduates of this programme across many of the specialties in internal medicine, paediatrics, obstetrics and gynecology, pathology, public health, occupational medicine. Next slide, please. Just the actual, I've given that overview. Thank you. The webinar. Next slide, please. Just to give you an overview of the actual team in the Royal College of Physicians of Ireland. That's me, Sinead Lucy. I'm the director here in the function. And then we've our senior manager, Sinead Freeman, Paula Kavanagh, our global training and partnerships manager, Adam Lecumber, our development executive, Anton Bambiliak, our global training and partnerships coordinator, and Susan Halim McConnon, our global training and partnerships program coordinator. Now, all of the team are on the webinar today, so if you have any questions, please use the chat function and we'll endeavour to respond to as many of your queries as possible during the webinar, and anything we need to clarify, we will get back to you afterwards. Thank you. Next slide, please. So just to give you a sense of what our mission, vision and values are, we recently updated our strategic plan last year, and it runs until 2029. And the mission is really to empower, develop and support our community of learners, trainees, members, fellows and society to improve health through training, education and advocacy. And the vision is to create a global community of doctors engaged and enabled to improve health. And our values are welcoming, trustworthy, respectful, responsive, connecting and challenging. And you'll see that these mission, vision and values are strongly aligned with the mission, vision and values within your own home country and your own health systems and what they are trying to achieve. And partnership is extremely important for us with key partners in the GCC countries, and aligning those vision and values is a key part of that. Next slide, please. About Ireland, so we are a very small island on the most western part of Europe. We're very well connected to the UK, Europe, North America and Middle East. We are one of two English language speaking countries in the EU, ourselves and Malta, but our close neighbours, the UK, are just a half an hour flight away. We have a mild climate, so you can see there's a nice umbrella icon there. I would highly recommend that you purchase an umbrella and bring one. But we have a nice average temperature of about 10 in winter, up to sometimes we might get to 20 degrees Celsius in the summer. We're a friendly place and very safe place to live. So we consistently rank very high in the Global Peace Index. So we're currently in 2025 ranked second. Home to 5 million people. And the Royal College of Physicians was established in the 1600s. So we have a very long tradition for excellence in postgraduate medical training, and this is internationally recognised. Next slide, please. So this is to give you a flavour of, it's a video from our tourist board, and it's a really nice video to give you a sense of music, culture, scenery, and life in Ireland. Thank you. So I'm going to hand over to my colleague now, Adam Lacomber, who's going to present the actual clinical fellowship programs and give you an overview on those. Thank you.
Thanks, Sinead. Hi, everyone. I hope you're all doing well. So my name's Adam. I'm the Development Executive within the RCPI Global Training and Partnerships team. And today I'm going to talk about our clinical fellowship programs, which offer clinical training to international doctors who are sponsored by their government, hospital, or national training body. Our programs provide a unique opportunity to develop professionally as a doctor and learn advanced skills that will be beneficial for the health services in your home country. So we can see here that the International Clinical Fellowship Program is offered across our 6 faculties and institutes. So we have the Institute of Medicine, Faculty of Pediatrics, Institute of Obstetrics and Gynecology, Faculty of Pathology, Public Health, and the Faculty of Occupational Medicine. So the duration of our programs is typically between 2 to 3 years. This will vary depending on the specialty in question. For further information on each specialty, you can see our QR code here on the screen just to visit our e-brochure. We'll reshare this at the end of the presentation as well. So on the next slide, we can see some highlights of our programs. So our programs are fully accredited with overseas health authorities, providing hands-on clinical experience with subspecialty exposure, including rotations across Irish hospitals within your chosen specialty under direct supervision by RCPI certified trainers within a multidisciplinary clinical team, focusing on outcome-based structured curriculums via ePortfolio. So this includes annual evaluation of your training progress with study days and complementary courses, along with research and audit involvement as well. The next slide outlines our clinical and academic supports, where we can see that each specialty is led by an international clinical lead or NSD, National Specialty Director, who designs the program curriculum, selects trainees for the program, assists their induction and annually assesses their progress, and provides support to trainees and also their trainers. We also have RCPI certified trainers who help new trainees adjust to the Irish healthcare system, work with trainees to meet training goals as per the curriculum, and signs off on end-of-year evaluations as well. So on the next slide, I'm going to talk a little bit about our entry requirements for our programs. So you can see here, to apply, candidates must be a citizen of Saudi Arabia, Oman, UAE, Kuwait, Qatar, or Bahrain. Candidates must hold a primary medical degree completed through English, have completed a structured internship, have completed residency training and the incorporated exams, have a minimum of 1 year's experience post-residency training in your chosen specialty. Also be eligible for registration onto the supervised division with the Irish Medical Council. So here for Omani candidates, they must meet a minimum English language requirement at the time of application, which is the OET. So that's a minimum of 2 Bs and 2 Cs taken within the last year, or an IELTS with an overall score of 6.5. So then to start in post, you must have an IELTS of 7 with a score of 6.5 in each of the 4 domains, or OET with a score of B in all 4 domains. Additionally, you must have confirmed sponsorship with a government body with whom RCPI has an MOU. There are also some specialty-specific entry requirements, which can be seen on this slide. So, for instance, we have geriatric medicine, in which case applicants must complete the MRCPI or MRCP UK prior to applying. Palliative medicine, applicants must complete 12 months of acute unselected take in required specialties prior to applying. For histopathology, applicants must complete the FRCPAT Part 1 prior to program start. And then occupational medicine, applicants must complete the LFOM exam prior to the program start date. So next, we're going to watch a short video showcasing a day in the life of an international trainee in Ireland.
Good morning, I am Dr. Tal Zahrani. Welcome to a typical day of my life here in Ireland.
It's an early start for Dr. Talal as he prepares for a busy day at Children's Health Ireland. A short walk from his new home, he begins his day with a sense of purpose and dedication to patient care. Dr. Talal makes his way through the vibrant city of Dublin, the capital of Ireland. Dublin is a safe and friendly city with lots to see and do. At Children's Health Ireland, Dr. Talal is part of a supportive environment where collaboration and teamwork are at the heart of patient care. After a busy morning with patients, Talal meets with his trainer, Professor Des Cox, and other consultants, who ensure he gains experience and exposure to a range of medical cases. Beyond the hospital walls, Talal enjoys moments of respite, savouring the rich culture and making friends in his new home. A day in the life of an international fellow is a tapestry woven with dedication, compassion, and a commitment to making a difference. Dr. Talal is working toward a brighter, healthier future, gaining important experience and skills to bring back to his home country.
Good afternoon, everyone. My name is Paula Kavanagh and I am the Global Training and Partnership Manager here in the Royal College of Physicians of Ireland. Today, I'll talk you through the RCPI process for International Clinical Fellowship Programme. So the purpose of this overview is to give you a clear understanding of how the recruitment process works from start to finish and to highlight the key stages involved, including timelines, assessment points, and decision-making milestones. Next slide, please. So what are the recruitment stages? Recruitment begins in April, which is when applications open. At this stage, candidates submit their application in line with the published eligibility criteria, programme entry requirements, and required supporting documentation. During this period, we focus on providing guidance and clarity to ensure candidates understand the requirements and expectations of the programme. The next phase takes place in June and July. Once applications close, RCPI undertake a structured eligibility, verification and application review process. This includes verification of documentation, assessments against the published eligibility and programme criteria, and the shortlisting of candidates in line with the specialty-specific requirements and available training posts. The final stage then takes place in September. Shortlisted candidates are invited to attend an in-person or online interview, which are conducted with the relevant key stakeholders. Following the interview process, outcomes are communicated, and the onboarding and pre-arrival process begins for successful candidates in preparation for their entry into the programme. Overall, this phased approach ensures a fair, transparent, and robust recruitment and selection process fully aligned with RCPI governance, quality standards, and programme requirements. With that in mind, I'd now like to show you a short video that walks you through the structure of the application process and provides a helpful visual overview of the journey from the application to acceptance.
The process of joining one of RCPI's prestigious international programs couldn't be easier. When you're ready to apply for one of our residency or fellowship programs, you can start your application online and through our website. For residency, you need to have completed your degree through English, completed or be near completing a structured internship. For fellowship, you need to have completed a primary medical degree through English, completed a structured internship, completed a national residency program, and passed the associated final board examination. For both residency and fellowship programs, you will require provisional sponsorship from a government body we have an agreement with. Remember, you don't need to have an English language certification or MRCPI to apply for either program. Make sure to submit all required documents correctly. And if you have any queries, just reach out to the RCPI team and we'll be happy to help. If your application is shortlisted, you'll be invited for an interview in one of the Gulf Cooperation Council countries. Successful candidates receive an offer within a few days. Officially accept your offer by email. The RCPI team, along with Castell Education, will support you right through onboarding into the program and training itself. If you need to meet English language proficiency requirements, we offer one-on-one tutoring to prepare for the OET or IELTS examinations. For those joining the residency program, RCPI tutors will provide tutoring and access to a question database for the MRCPI Part 1 examination. RCPI and Castell Education will help you register with the Irish Medical Council, visa applications, and finding accommodations, schools, and childcare. We even assist with everyday tasks like opening a bank account. You will arrive in Ireland 2 weeks before your start date to settle in your new home, attend an induction day, and then begin your journey to advance your medical career in one of our Irish hospitals. Graduates from the Royal College of Physicians International Residency Training Program and International Clinical Fellowship Program have gone on to achieve the following roles and advancements in their careers. Apply to an international program with RCPI today.
Thank you for your time. I'll now hand you back to my colleague Adam, who will talk you through the onboarding process.
Hi again. So now we'll walk you through a very simplified outline of the onboarding process. So within the Global Training and Partnerships team, we have a dedicated coordinator to help you progress through the onboarding process. So the first stage of the process is the one-to-one onboarding meeting, which really is an opportunity for a coordinator to introduce themselves to our candidates. So this one-to-one meeting also gives candidates an opportunity to ask any questions you may have as you embark on your training journey with RCPI. We then refer you to our brilliant colleagues in Castell Education for English language tuition or relocation services, who we will hear from shortly. The next step is then to liaise with the clinical lead for each program, who will confirm your year one clinical placement or hospital allocation. This is confirmed well in advance of your program start date to give you enough time to secure accommodation in your allocated training area. Once each of the above steps have been complete, we can then apply for your work permit under the atypical working scheme. So this is needed for you to take up post in Ireland. RCPI will apply for this on your behalf. And coming towards the end of the process, Castell will then assist you with your entry visa application while also advising you with regards to your travel plans from the Middle East to Ireland. Provided the candidate successfully moves throughout the onboarding process and has arrived in Ireland, you are then handed over to my colleagues in the international delivery team, who will support you for the duration of your training program in Ireland. Lastly, you will attend our induction in Dublin, which is a great opportunity to meet your fellow international trainees and to link in with RCPI staff in advance of commencing your program with us. I'll now hand you over to my colleague, Ms. Hannah Flynn from Castell Education, who will tell us more about their relocation supports and services.
Thank you very much, Adam. So first of all, as Adam said, my name is Hannah, and I'm Head of Postgraduate Services here at Castell Education. So thank you to RCPI for inviting us to participate in today's webinar. What we'd like to do over the next few minutes is just tell you a little bit about how we here at Castell can make your transition to Ireland that little bit smoother with our personalised English language tuition and then a range of pre-arrival and in-country support services. So the next slide, please. For any trainees who have yet to meet their English language requirements, RCPI will refer you to us here at Castell for English language preparation. So we'll send you a welcome email outlining the English language services that we provide. And then we'll gather information from you on your exam preference, so be it IELTS or OET. We'll gather your level of English, if you have an exam booked already, your availability for tuition. And then you'll be assigned a personal professional English language tutor, and they'll contact you then to schedule in one-to-one classes. So your tutor then will carry out an initial diagnostic assessment just to determine your level and just to see what gaps or what skills that require the most attention. There's also a correction service available if you wish to submit any pieces of writing, and there'll be one-to-one speaking practice. The tutor then will track your progress, and feedback is provided to RCPI on a fortnightly basis just in relation to trainee engagement and progress. So Castell will work with you until you sit your exam. Then once you receive your results, we'll review them. For any trainees who have not met the requirement, you'll continue with your tutor and getting your English language tuition. And then when a trainee has met their English language requirement, then you're referred onto me here in the postgraduate services to begin the first stage of your relocation support. So next slide, please. So once a trainee is referred to us for the relocation support, the first thing that we'll begin to work with you on is your medical counsellor registration. So what we'll do is we'll give you lots of, I suppose, detailed, very easy to follow step-by-step guidelines for each part of the process, from getting your credentials verified in EPIC, to getting your supporting documents notarized, to completing the online medical counsel application form. We'll review your application with you just to make sure everything's fully prepared before you submit. Then, as Adam mentioned, once you get your work permit, your atypical working scheme, we will then give you guidelines on applying for your visa. We can review your online visa application for you before you submit, and we can also provide you with templates for some of your supporting documents. If you are bringing any family with you, we can advise you on their visa applications. And then once you're here in Ireland, we'll guide you through the process of applying for your Irish residence permit, your IRP card, which effectively takes over from your entry visa. And at any time, if you need to travel to a third country for any courses or conferences as part of your program, we can provide you with advice on applying for visas for those countries too. So in terms of accommodation, Castell will support you every step of the way. So from giving you advice on temporary accommodation options for your initial weeks in Ireland, to working with you to establish your preferences, and based on your requirements, we can give you some permanent accommodation recommendations and options. We are happy to arrange appointments for you to view properties that you're interested in. We're happy to liaise with agents and landlords on your behalf, and then help you submit the applications for any properties that you'd like to proceed with. Then once you've been accepted for a property, we can review your lease for you and then give you just move-in advice and advice on setting up your utilities. For any trainees coming to Ireland with children, we can support you then in your search for a school place or a childcare place. So when your hospital location is confirmed by RCPI, we'll work with you to establish your school and childcare requirements. We'll contact the schools and the creches on your behalf. We'll establish the vacancies, and then we'll send you on the application information. So then next slide, please. When you've booked your travel for Ireland, we'll arrange a driver to pick you and your family up at the airport and transfer you to your temporary accommodation. You'll be presented with a personalised welcome pack upon arrival. And then just during that initial transition period, we'll have an out-of-hours support service available to you, just in case anything urgent should arise. And we'll also arrange welcome video calls with you after your arrival, just to kind of help you on what to focus on in your first couple of weeks here. And then once you're settled in your permanent accommodation, we just give you lots of information and advice on settling into life in Ireland. So from getting your bank account, getting a mobile phone number, setting up other utilities, getting your private health insurance. If you're interested in driving in Ireland, we can guide you through buying a car, renting a car, finding a GP. We'll give you information on the local transport network, local orientation, anything that you need. And that support then is available to you then for the entire duration of your program. So any questions that you have, like of a non-academic nature, just always feel free to reach out to us. And anytime that you'll be rotating to a new clinical site, we'll guide you through getting new accommodation, if you need new schooling or childcare for your family. At different times in the process, you might need to, say, renew your IRP card, renew your medical council. We'll guide you through all of that, all the way up until the very end of your programme. We will give you some information on preparing for your departure. So I hope that has just given you a little bit of insight into what Castell's role is here and just how we can make your transition a little bit easier and smoother. So thank you for your time.
Thanks, Anton. Hi, everyone. My name is Zoe Edwards. I'm the Education and Training Delivery Manager here in RCPI. If you just go to the first slide there, Anton. Thank you. Perfect. Don't know why there's a scribble over there. It's not mine, I promise. As Adam mentioned earlier, once you have gone through the really extensive onboarding process to enter onto the clinical fellowship program, once you've arrived in Ireland and are ready to start your program, is when you'll be handed over to our team. So we're basically here to support you end to end from the start of your program right through to program completion. So this is the team here. So on the International Clinical Fellowship Program, you will have a dedicated program coordinator, and that is Mappy DeFenio. So she is really your initial contact person for any support that you may need throughout the program. And we have a number of supports listed there. We're here to ensure that you can meet your program end to end in terms of your curriculum. So we provide support for your e-portfolio system. So you'll receive a training session in that, and we can also offer support as you move through your program to ensure that you're logging and completing all of your clinical and educational requirements. We also provide support for any general program queries that you might have, and we are the initial liaison person between yourself and your trainer. We also have an international hub, which is a virtual learning environment where there's a number of supports available to you in the form of reading resources and also videos to help you adjust to the Irish healthcare system, but also signposting to different supports within the college. We also provide opportunity to attend study days and educational programs, and will signpost those opportunities to you. As Adam mentioned earlier as well, you have an annual evaluation with your clinical lead. So we facilitate and run those evaluations for you and link you in with your trainer to complete your various quarterly assessments as well. We also provide support meetings, so we will check in very early on in your program to see how you're settling in, but we will also check in with you at various points during the year just to ensure that you are getting on okay in the program. So we're always available for a one-to-one support meeting, and Mappy will signpost that to you as you start the program. We can signpost you to various functions within the college as well. We have a health and wellbeing department who are there to support you and can link you in with various supports within the Irish healthcare system as well. If you are looking for information on exams or particularly related to your curriculum, we can also signpost you to that team as well in our education department. There's a QR code on the screen there as well that is linked to our international training handbook. You will receive a copy of this at your induction when you arrive in Ireland as well, but if you'd like to scan that, that also lists all of our policies and procedures and kind of outlines the program from start to finish as well. So it's a useful resource to have. Happy to answer any questions on the kind of in-program side of the house. If you want to pop anything into the Q&A box there, happy to answer that. I'll hand back over. Thank you.
Thank you, Zoe. So I think now we're moving on to the panel discussion phase of this webinar. So I'm going to hand over to my colleague, Sinead Freeman, who's going to chair this session. Thank you.
Hi, everyone. Welcome. Good afternoon. As Sinead said, my name is Sinead Freeman, and I'm the Senior Manager for Examinations, Global Training and Partnerships here in the college, and I'm very pleased to facilitate today's panel. I hope everyone found the presentations earlier helpful, and I will now ask the panel just a number of trainee-focused questions. So the aim really of this session is to give you a better understanding and insight into our International Clinical Fellowship Programme and to provide you with actionable takeaways from this afternoon's session. During the panel discussion, we will also answer as many questions as we can in the Q&A chat box. So firstly, I will introduce you to our panel. We have Prof. Cecily Quinn, who is the International Clinical Director for all of our programs, and she's also the International Clinical Lead for Histopathology. We have Prof. Declan Cody, who is the International Clinical Lead for Pediatrics. We've Prof. Conal Denedy, who is the International Clinical Lead for Endocrinology and Diabetes. Prof. David Bradley, who's the International Clinical Lead for Urology. Hannah Flynn, who you met earlier, is the Head of Postgraduate Services with Castell Education. And Sinead Lucy, who is the Director of Business Development Exams in RCPI. So I'll just start off with the first question, and I will start the session by asking Prof. Quinn, what diagnostic responsibilities are fellows expected to undertake as part of the programme?
Thank you very much, Sinead. So I speak for histopathology, really. So somebody coming in to do a clinical fellowship, they're expected to participate fully in the diagnostic service. Now, this does take place under consultant supervision, and that consultant supervision really carries right through to the end of training in histopathology, which differs really from many other specialties. Obviously, everything is consultant supervised, but it's very heavily so in histopathology. Everything is double signed with graded responsibility as somebody becomes more senior, but there is very focused consultant supervision throughout. So the duties really that somebody would have, first of all, they would participate in specimen dissection, examining the specimens, block taking, maybe a specimen x-ray, whatever is necessary, constructing a comprehensive macroscopic description, and then they would get the slides from the specimen, maybe that later that the following day or in 2 days. They review those, construct a microscopic report which is clinically focused, and then they discuss that, review the slides, etc. with the consultant. Fellows are also so they're also encouraged then to participate in multidisciplinary team meetings, both to attend those and to present selected cases with the consultant during their time. Then here we also encourage them to do an audit during their training period, and also to take a role in teaching, to supervise junior trainees and indeed medical students, depending on whether or not they're present here at that particular time. So the duties really are very similar to what they would be doing in their own country, but with a greater focus on individual specialties and gaining more experience.
Thank you, Prof. Quinn. My next question then is to Prof. Bradley. How much clinical autonomy do international fellows typically have?
Thank you. So, I mean, the fellows will, after a settling in period, be expected to perform similar to any of our other training doctors, and they'll be part of a team with other registrar, SHO, intern level doctors. So they'd be more senior in that structure. So it would be expected that they would have a good opportunity to develop their skills over a period of 2 to 3 years typically. And as for our local trainees, that as they become more confident and have demonstrated competency, they will be given more latitude to perform with indirect supervision. It is the case that in neurology, my own specialty, that is very heavily consultant provided. And so the level of supervision is certainly persists as being very significant, but there will be good latitude to allow trainees to develop their confidence and their independence as they progress through the program, and they will typically progress across different sites, allowing them to experience different types of departments and also different team structures. So that will naturally develop over the course of the 2 or 3 years.
Thank you, Prof. And then just the next question then is for Prof. Cody. What age groups and paediatric subspecialties are fellows most exposed to?
Well, firstly, apologies, my camera isn't working. I tried yesterday with Anton, but it just couldn't get it working. So it's just me talking. So pediatrics is essentially 1 day of age until 17, 18 years of age. So you get the complete breadth of pediatric training, and you will get exposed to kids of all ages in your in your specialty. The outpatients, again, you're probably getting a slightly older child coming into the adolescence and into young adult as well, up as far as 17 or 18 years of age before they're transitioned on. But in terms of what age, it's a bit like what they have in their own countries. What you're having in your own country. Again, it's children of all ages, from 1 or 2 days of age, all the way up to the older adolescent, I guess.
Thank you. And then finally, Prof. Kennedy, what level of exposure do fellows get while managing complex multi-morbidity cases?
Yeah, they get a high level of exposure again, I'd speak for endocrinology, but I'm also very aware of cardiology, gastroenterology and the other medical specialties, rheumatology, for example. Often the International Clinical Fellow actually gets nearly a privileged exposure to their trainer. For example, in my case, I will give the fellow perhaps 10 very interesting, very complex cases that they will either help manage and learn about their management sometimes from the beginning if the patient presents anew, or alternatively, some patients that have been attending me for some years, I will give to the International Clinical Fellow, and they will be expected to follow that patient, but not just to follow them going forward, but also to be very aware of their past history and to see how they were managed up until the point at which they arrive. And we would meet then on a weekly basis, sometimes a fortnightly basis, to discuss individual cases. That's how the learning is done. The learning is done by experience. It's not didactic learning. It's not learning by lectures. It's learning by experience, by reading, by looking up, by interrogating the evidence. The fellows will be supervised during complex cases until they have a degree of independence in their own decision making. As trainers and consultants, we would evaluate their decision making prior to the fellows starting to make decisions themselves. So we would ask them, what do you think you would do next with this patient? What do you think you would do next? How would you investigate this patient? What is the most appropriate treatment for this patient? And then as the year develops with each of the trainers, as they pass through each of the trainers' hands, they get more and more independence. They still have the same level of supervision. So they get a very high exposure. Anyone that comes to me each year would see 3 or 4 pheochromocytomas, 5 or 6 patients with adrenocortical carcinoma. These are extremely complex cases. 20 or 30 patients attend me with congenital adrenal hyperplasia that they would manage. So these are the complex types of cases that I would expect the fellows to come back from training with me alone to be proficient in. And that's independent of looking after complex feet, looking after complex type 1 diabetes, looking after complex diabetes cases, and also looking after the very ordinary cases such as thyrotoxicosis, Graves' thyrotoxicosis that comes in the door.
Thank you, Prof. Kennedy. I'll go back to Prof. Quinn now for my second question. How much exposure is there to subspecialty or advanced pathology services?
Thank you, Sinead. Well, there is quite a significant degree of subspecialisation in histopathology in Ireland in the delivery of the various services, with particular emphasis really on catering for personalised medicine. So all of the large departments offer subspecialty training in a wide variety of specialties: breast, GI, liver, dermatopathology, soft tissue, etc. So if a clinical fellow is still in training and is working towards the final FRC path examination, they would rotate through all of the various specialties and gain experience. And we find our hospitals tend to be quite complementary in terms of specialisation. Some areas are very well represented, for example, in St. Vincent's, others very well represented in St. James's, for example. Cork has a great variety of specialties all under one roof, as has Galway. And also the same goes for the North Side, Mater and Beaumont hospitals hospitals would be quite complementary. If then we find a trainee or a fellow is post-examination and they want to gain particular expertise in one area, we can slant their training or part of their fellowship towards that. And then as part of that subspecialty training, we would encourage them to read a lot in that specialty, go to the relevant MDTs, get to know the clinicians and really get to know the clinical context of what they're reporting. So I would say really pretty well all subspecialties are very well represented in Ireland with very good training opportunities. And as I said, that would be tailored accordingly depending on the stage of training.
Thank you, Prof. Quinn. Prof. Bradley then, how does the fellowship support progression towards consultant-led decision-making?
So, I mean, given that trainees typically will complete a 3-year program, sometimes a 2-year program, much like our last answer, the subspecialization is something that develops as the trainee goes through. We have models where trainees will do 3 general years, and very similar to what our local trainees would do as part of their core neurology training. And we have other trainees who have significant experience already coming into the program and really want to get quickly to subspecialization in an area such as multiple sclerosis, movement disorders, and all of these can be accommodated. And all of the major centers, level 4 hospitals, university centers have all of these subspecialties available. And a trainee can very much be provided with whatever it is they need to develop their portfolio of skills and competencies to tailor to what they need to bring back home. So in terms of consultant level decision making, that autonomy is something we build up as the trainee goes across the years. But the other thing that we do is we will gear towards areas that they want to focus on. Common themes that we get coming into us are headache, epilepsy, and then more recently some of the neuroinflammatory things of multiple sclerosis. That can be worked in as in a form of fellowship towards the end of training to make sure that somebody going home has what they need to gear towards a particular consultant type role that they may have in mind. And that goes along with the fact that as their autonomy builds, their ability to practice independently and competently is supported. That's supported through the ongoing assessment phases.
Thank you, Prof. My next question then is to Prof. Cody. What level of responsibility do fellows have in acute and complex cases?
Yeah. I suppose in a 2-year program, the first 6 to 12 months is really getting the fellow embedded into the clinical team. So at that stage, there wouldn't be a huge amount of responsibility. They would still be expected to do all the things like attending clinics, attending emergency department, ICU, but there would be a lot of consultant supervision, I guess, over that first 12 months. From there on, really, the fellow often takes a more senior role, even among because we have obviously the SBRs, the specialist registrars, SHOs change every 6 months, while the fellow would have been there for the previous year. So they would start to take a much more senior role within the team in terms of at times seeing patients without having consultant supervisions. For example, in our diabetes clinic, our fellows would see patients on their own and let them go. We would encourage them to lead on ward rounds and sometimes with us in the background. Within the last 6 months or so, some of them start to do a kind of a first on call service where they will be available at night if they wish. I guess this is a kind of agreed within the team, between the fellow and the consultants, that they may take an opportunity to offer and perform a first on call service. But I guess it's really at the behest of the fellow, how quickly they move, how much responsibility they want to take on. But there's huge scope for a very senior role by the end of their 2-year attachment.
Thank you, Prof. And then just finally then on to Prof. Denedy. Are fellows involved across acute admissions, ward rounds and outpatients clinics?
Again, that's specialty dependent. For example, in gastroenterology and cardiology, the fellows will be involved in gastroenterology, for example, they are involved in acute medical take and they are on the ward rounds. because it is critical to gastroenterology that they would see the acute intake of patients who would have inflammatory bowel disease, or an acute exacerbation of that, for example, or acute or sick livers. Within endocrinology, we don't expect anybody to do general medicine, and they don't do acute general take. But for example, depending on the hospital that they're in, there may be an on-call service to the emergency department during the days, whereby they would go down and manage diabetic ketoacidosis if it came in, an adrenal crisis if it came in, patients with severe hyponatremia that might require hypertonic saline, for example. So they're the type of things that acute medicine that they would be expected to look after. We would also expect the fellows to go on to the consultation round. This is one of the very essence of their learning, that they would see consults and see consults with the consultant. Again, this very good one-on-one exposure to the consultant trainers right across the board, not just your individual trainer, but the many trainers that are on the team. For example, our team has 10 endocrinologists on it. You want exposure to each of those with their own unique perspective on how to manage patients that are on the wards. Again, within outpatients, there's a curriculum there. There are a number of outpatients clinics that you have to attend. The outpatients clinics are busy, and you will be expected to see at a general endocrinology clinic 8 to 10 patients at a minimum. You would be expected to see in the diabetes clinic many, many more than that, maybe 12, 14 patients. So they are busy clinics. There's not always time to talk to, or there's not always time for formal teaching at the outpatient clinics, but you do gather information about your patients and you discuss them at a later time with your consultants. So there'll be a very big exposure. There'll be a large case mix of patients that will be seen. Again, as the clinical lead, I expect the fellows to document the patients that they have seen and to have a very good logbook that goes through multiple cases, and I will pick patients at random from those cases, from the logbook, to ask the fellows to discuss those cases and how they manage them, and to reflect on those cases at the assessment at the end of the year. And I know that the other clinical leads do the same thing. So that will be the overall exposure that the fellows have. There's a large exposure. There's a large case mix there for the fellows to see. Beyond just the complex, there's the ordinary everyday, there's the acute, there's the non-acute.
Thank you, Prof. My final question then for the clinical leads. Prof. Quinn, are fellows involved in multidisciplinary team meetings and case discussions?
Yes, thank you, Sinead. Multidisciplinary team meetings are now considered really to be an integral part of patient management, and involves the coordination of clinical, pathological, imaging findings, discussion by all members of the team involved in patient care. So we very much encourage our fellows and our trainees to attend these meetings, and also to participate in them, to present cases that they may have worked up. So that is something that we have multidisciplinary team meetings, several every week, and that is a part and parcel of their training, and a good opportunity for them to develop their skills in terms of communicating results verbally, etc. With regard then to case discussion, we also encouraged our fellows to participate in journal clubs, which sometimes involves reviewing a case and then a literature review. We also encourage them to participate in all of the RCPI study days, some of which are also case-based. So as well as learning the skills of microscopy and developing their skills further in that regard, we very much encourage our fellows to be part of the overall team. So plenty of opportunity there. Thank you.
Thank you, Prof. Quinn. And then Prof. Bradley, how is supervision structured for international trainees?
So it's modeled very much on the supervision we already use for our specialist trainees, registrars and SHOs, that patients or trainees are very much supervised in clinic settings, on consult ward rounds, inpatient reviews, on call, if there's daytime call, for example, to review a stroke in the ED, something like that. So the supervision is very much that for a lot of tasks, especially in that first year, there's direct one-to-one supervision to make sure that the trainee acclimatizes to the environment, is confident, is comfortable. And as time goes on and their autonomy is allowed to develop, then it's more, reflection back on case discussions, for example, where there isn't direct supervision for specific activities. The supervision will it vary from trainee to trainee because everyone is different, and that needs to be customized to the individual trainee, how they respond, what their mode of learning is, and how they can be best supported to develop independence, which is really the aim at the end of the fellowship, is that they've developed a set of skills that are relevant to them and to their supporting body that they can bring home, and that they can provide a higher level of service than otherwise they would have been able to, having benefited from the scheme. So what I would say really is that the mode of supervision is modeled on what we already do for our local trainees at registrar and SPR level.
Thank you, Prof. Bradley. Prof. Cody, how does the fellowship prepare trainees for senior paediatric roles?
Yeah, thanks, Sinead. I guess a lot of these answers have come in previous questions as well. So, but it's the same as what we said previously. So, in trying to prepare the fellow for a senior clinician role or senior consultant role when they get back home is when they start with us, is by year 2, entrusting them with, I guess, clinical autonomy as their fellowship progresses, where they get to the place where they're seeing patients, deciding next steps as an independent senior doctor and deciding investigations, but of course coming to the consultant as well just to discuss these, but taking on a much more independent role. We obviously encourage, again, as was previously mentioned, attending the compulsory RCPI programs, leading at the MDTs in terms of preparing CPD for all the team members. We certainly encourage all our fellows to attend the National Paediatric and International Paediatric Specialty meetings, and we encourage them to prepare audit, maybe write up a paper on the audit. That's something we think would be of great value. And of course, when they go back home, then we always encourage them to stay in touch and to keep in touch with us, and that we're always there if they have cases, and we still offer them the opportunity to join our MDT meetings if they're able to dial into it.
Thank you, Prof. Cody. And then finally, Prof. Kennedy, what opportunities exist for research, audit, or quality improvement projects?
Yeah, lots. So it's expected that audit and quality improvement projects are carried out on a yearly basis. That's part of your logbook, and it's something that must be sorted out as your training within your training plan at the beginning of the year. This is something that we really want the fellows to bring back with them to the Middle East, to the intrinsic practice of audit and quality improvement in the delivery of patient care. Research is always available. It's something that the fellows take up upon their own initiative. They will approach their supervisor and they will express whether or not they're interested in carrying out some research. And it comes in many forms. In general, there is no time for bench research or lab research to be carried out, but there is a lot of clinical research, and there are opportunities for the fellows to do summer or to do schools and courses in things like data analytics, the use of artificial intelligence, particularly things like Claude, etc., in order to help them along with the research to access large international databases. There are often large research projects going on in many of the centres, and there will often, for example, in endocrinology, Beaumont and ourselves have a number of clinical trials going on through the clinical research facilities there that the fellows can partake in, and they can become sub-investigators on clinical trials, large clinical trials. And that's a very good opportunity for them to learn how clinical trials work and perhaps to try and attract clinical trials to their own institutions when they come back. And then in addition to that, there will also be, for example, PhD students and MD students who are doing projects and postdoctoral students who might be part of larger projects that principal investigators have that the fellows can get involved in. For example, Mera, who was a fellow a number of years ago, she got involved in what's called the DAISY study, which was a large study that Mick O'Reilly had a PhD and MD working on, as well as some fellows working on this over in the UK, along with Vipka Art. And she managed to network through the UK, Germany, and Ireland with the research that she did, and made some very valuable associates through that research. So yeah, the opportunity is there. But again, it is really important for the fellows to understand that this is based on initiative. Nobody is going to chase you down to do research. The research is something that you ask about and that you will be given the opportunity to do. And when you are given that opportunity, you should capitalize on the opportunity. It is not something that we force upon the fellows, but it is an opportunity that we are perfectly willing and happy to give to the fellows, and really welcome the fellows asking about it. And as long as the fellows themselves take the initiative, we will help them along the way, but they must first and foremost take that initiative in order to carry out the research and to do the research that they're asked.
Thank you, Prof. Kennedy, and thank you to all the clinical leads for that informative Q&A session. So the final question then before we finish is for Sinead Lucy. And Sinead, as Director of International Training and Examinations, what is the one key takeaway from today's session that you would like the audience to remember? Sorry, you're on mute there, Sinead.
Apologies. I might make one or maybe more than one recommendation. So just to reiterate, the current recruitment window is open and the applications will close in June. And that's with a view to interviewing in September. So the September interviews would then have a in-program start date of July 27. So just bear that kind of timeline in mind. I would really advise to reach out to alumni of the program. As I said at the beginning, we have close to 200 alumni of the fellowship program alone, and also current trainees. So, get a sense of what it's like to apply, to undertake the interview, if you need to engage with the English language, tuition with Castell, understand what that experience is like. And then if you are successful at interview, I would really recommend that you engage with our partners Castell as soon as possible, especially if you have to take an IELTS or an OAT exam, and also to sort out accommodation or childcare or school requirements. Pay particular attention to your curriculum. You need to review it. You need to engage with the team here in RCPI if you have any questions, queries. If you'd like to get involved in other things, like Prof. Kennedy mentioned, the time to start doing that is the earlier the better, really. And then, yeah, just to really echo what the clinician said, like, make the most of your time here. Look at the opportunities to get involved in research, in audit, to attend conferences or any AI initiatives. Show some initiative and get involved and put yourself forward for those. And then just finally, I just want to thank you for attending the webinar. We've recorded it, obviously, and we'll be circulating the recording, and you can pass to any colleagues that might be interested also. If you have any queries at all, we have the QR code, I think, coming up in a few minutes, Anton. So you can look at the e-brochure, you can get in contact with the team. We're here 5 days a week, 9 to 6. So please do get in contact with us. And finally, I would just like to thank our clinicians for taking the time out of their busy schedule to share their insights and information with you.
Thank you, Sinead. I'd just like to reiterate what Sinead said there. Thank you to all the panel. Thank you to the RCPI team for organising today, and for the audience for your time. And the QR code is up there. I would also encourage everyone to go to the RCPI website to look at the e-brochure. It's very informative. It has all the information that you need to know about the programs, the entry criteria, the supports available, etc. So the e-brochure, is really a go-to kind of tool for all you need to know about the programs. So if nobody else has anything to add, I think we can finish the session for today. Thank you, everyone.
Thank you.
Thank you.